My name is Jennifer Molina and I'm a full spectrum doula. Doulas provide advice, information, emotional support, and physical comfort to a birthing person before, during, and after birth. In my practice, I help patients understand what's happening to their body as it relates to prenatal, pregnancy, birth, postpartum, abortion, and pregnancy loss. Typically, I tell clients that they should start packing their bags around 34 weeks. And you can start earlier, of course, but either way, you want to make sure that there are certain items in your bag to help ensure a smooth stay at the place that you plan to give birth. First, you want to make sure you have your important documents. ID, health insurance information if you have insurance, and then hospital registration forms. Make sure you have contact information for the doctors if they're not in the system, and any special health issues tied to your pregnancy. It's helpful if it's a hospital that does not have your records, which can happen. And you also want to make sure you have copies of your birth plan to distribute to providers and nurses. Ideally, you would have discussed this with your provider at a prenatal appointment, but it serves as a reminder for your care team. And lastly, the pronoun pins or name tags. And these are great if you'd like a not so subtle way to remind hospital staff of your pronouns without having to constantly tell them. Think about the environment you want to create in the hospital or the space where you plan to give birth. It might help to think of the hospital as a really expensive hotel room. And you will be there for at least a few hours, maybe a few days, so bring things that you find comfort in, such as photos of loved ones, a speaker to play music, or pillows from home. It's also great if you have tools to help, such as a heating pad, massage oils, a blanket, and your favorite playlist to keep you calm. Just like any overnight trip, you want to bring your toiletries, especially lotion. Pregnancy can take a toll on your skin, hospital air is dry, and lotion is also great for foot massages. If you forget your toiletries, it's not a big deal. Most hospitals have toiletry items available for postpartum folks. Some people also like to bring clothes to give birth in instead of the standard hospital gown, be it a robe or personal sleepwear, something loose-fitting and easy to remove. Disposable underwear and absorbent pads are also a must if you don't elect to wear what a hospital would provide. And if you're expecting a C-section, the average hospital stay is 2 to 4 days, so having extra clothing and personal items could make this time more comfortable. For your little one, you also want to pack a newborn-sized footed onesie and a car seat for them to go home in. For yourself, you also want to pack comfortable, loose-fitting clothes. Your hospital will most likely send you home with diapers, blankets, pads, and other items, so you'll want to bring an extra bag for those items too. Giving birth is an exciting time, but there will also be a lot happening the day of. And checking this off your to-do list before you're in labor will definitely help. Happy packing!